Hi, everyone. Thank you for joining the COVID-19 Therapeutics Pathway webinar training today. My name is Molly Stillians, and I am an infection preventionist with the CDC. My primary area of focus in my role at the CDC is using NHSN surveillance to improve outcomes in long-term care facilities. So after my presentation concludes, Kathy Brideson will have a presentation about the POC test reporting tool, so stay tuned for that. And then also, if you have any questions during the presentation, please put them down in the Q&A box, and our subject matter experts will work on answering those for y'all. So we'll have 3 learning objectives today. The first learning objective for this training is the NHSN COVID-19 reporting options available for long-term care facilities, including the structure of the NHSN long-term care facility COVID-19 module. The reporting options include manual data entry or importing and exporting with CSV files. Our second learning objective for this training is to review the steps to access the COVID-19 module and the 5 surveillance pathways for data reporting. So once you're signed into NHSN, you will see a menu on the left-hand side of the page. This is where you will find the COVID-19 tab. So if you click on the COVID-19 tab, you'll then see where you can click on daily entry, POC test reporting tool, COVID-19 vaccination for healthcare workers, and COVID-19 vaccination for residents. To find the therapeutics pathway, you'll want to click on daily entry. Soon, the daily entry link will appear as pathway data reporting. This will likely happen with one of the next NHSN releases. There's not a specified date for that yet, but when you log in and you click on that COVID-19 tab, eventually you will see pathway data reporting. So for now, you will still see daily reporting, and that's what you will click on to enter data for the 5 surveillance pathways. But coming in the future, you will see pathway data reporting there. And then our third learning objective for this training is to apply NHSN criteria to surveillance data reporting in the therapeutics pathway of the COVID-19 module. So the therapeutics pathway is fairly new to the COVID-19 module, and we will discuss that pathway in more depth today. Next, I will review how to access the COVID-19 pathways in the NHSN application and data reporting options. So NHSN, the National Healthcare Safety Network, is a secure internet-based surveillance system managed by the Centers for Disease Control and Prevention. It is the most widely used surveillance system in the US. It is used by diverse healthcare facility types, such as hospitals, outpatient dialysis and surgery centers, and of course, long-term care facilities. These different facility types use NHSN for the systematic collection, analysis, and summarization of healthcare data, including healthcare-associated infections, antimicrobial use and resistance, adherence to prevention practices, exposures and outcomes, and more. NHSN is developed and maintained by a diverse set of subject matter experts with decades of experience in public health, infectious disease, healthcare infection prevention and epidemiology, healthcare informatics, and statistics. These subject matter experts participate in ongoing collaborations with local and state public health agencies and professional groups, all of which we consider to be an operational imperative. The NHSN long-term care facility component supports the nation's COVID-19 response through the long-term care facility COVID-19 module. This module was released on April 28th of 2020, and data reported into this module are immediately available for use in strengthening local and national surveillance, monitoring trends in infection rates, assisting in identifying resources and insecurities, and informing progress towards infection prevention goals. So this module has distinct reporting options, one being the 5 surveillance pathways for data reporting, in which reported incident counts and response data are used to facilitate assessment of the COVID-19 impact on facilities, residents, and staff. So this is where you'll report therapeutics data. The COVID-19 point of care test reporting tool was also added to the module in late October of 2020. And this provides a platform for facilities to report COVID-19 point of care test results. Facilities are also able to report resident and staff COVID-19 vaccinations through NHSN using the vaccination modules that are present under the COVID-19 tab within NHSN. These modules are separate from the surveillance pathways and are specific to vaccination status for resident and healthcare personnel. So I'll show you where you can find that information later on in the presentation. Okay, so facilities eligible to report COVID-19 data to NHSN include skilled nursing facilities and nursing homes, assisted living facilities and residential care facilities, and intermediate care facilities for individuals with intellectual disabilities. This is currently labeled in NHSN as intermediate and chronic care facilities for the developmentally disabled. So here we've got our 5 surveillance pathways. And these pathways, collectively, these pathways optimize timely, standardized data collection used to strengthen COVID-19 surveillance locally and nationally, in addition to informing ongoing activities to support providers and direct resources. So our first pathway that we have here is the resident impact and facility capacity pathway. This takes into consideration facility capacity based on bed size and current capacity, as well as resident impact for COVID-19 for the reporting week. This pathway also assesses SARS-CoV-2 viral testing capacity and resources for a facility during the reporting week. In this pathway, vaccination status for residents who have a newly positive test will be reported here as well. Our second pathway, the staff and personnel impact pathway, assesses staff and facility personnel, including temporary staff and volunteers, impact for COVID-19 for the reporting week. This pathway also assesses staff and personnel shortages during the reporting week. Our third pathway that we have listed here is supplies and personal protective equipment pathway. This assesses the availability of alcohol-based hand rub and personal protective equipment available during the reporting week. This pathway will also assess the need for additional government resources and outreach for the reporting week. See our fourth pathway here, ventilator capacity and supplies pathway. This is only relevant to facilities with ventilatory units or beds, and the reported data provides important information in relation to the availability and use of mechanical ventilators to care for COVID-19 residents, as well as ventilator supply and availability. The fifth and newest pathway is the Therapeutics Pathway, and that's what we'll focus on today. This pathway assesses the number of residents who received treatment with monoclonal antibodies from either supplies stocked in the reporting facility or stock stored at a facility other than the reporting facility, so stock stored outside the reporting facility. Okay, so as mentioned previously, there is a separate module for vaccination status for healthcare workers and vaccination status for residents. So if you log into NHSN and you go to the COVID-19 tab here, when you see the pop-out menu at the bottom, you will see COVID-19 vaccination for healthcare workers and COVID-19 vaccination for residents. So that's where you will report that type of data. Listed here is also the website for the COVID-19 vaccination module. And you can see that over here on this side of the screen. And this will provide you with a lot of information and guidance as far as the vaccination module. So some tips for reporting into the therapeutics pathway. It is expected that users will consistently collect and report data into the NHSN long-term care facility COVID-19 module using the instructions available for the selected surveillance data reporting pathway. Consistent and timely reporting is important for assessing local, state, and national trends, as well as in response efforts. So for the therapeutics pathway, you will only need to report once a week. The counts for residents who received a therapeutic must only include residents newly receiving a therapeutic during the reporting week. So in other words, only the new counts since the last date therapeutic counts were collected for reporting to NHSN. Do not include cumulative counts from previously reported weeks. And then also, when you are reporting weekly counts, be sure to record the number of residents who received a therapeutic that was not in combination with any other therapeutics accurately. So for example, if a resident at your facility receives bamlanivimab and bamlanivimab alone, not in conjunction with any other therapeutic, you will select bamlanivimab in the application. Do not also select bamlanivimab plus etesivimab in the application. So to reiterate this here, you only need to report once during the reporting week. Please do not report any cumulative counts, and make sure to report a therapeutic given in conjunction with another therapeutic accurately. Also, just be aware of any local and state requirements that your state may have. So here is the NHSN Long-Term Care Facility COVID-19 Module webpage. Users are strongly encouraged to take advantage of the resources available on this webpage. It is the best resource for users reporting data into the COVID-19 module. So as you can see on the slide, the webpage provides users with access to enrollment, information and resources, trainings, including upcoming and archive trainings. And the most updated data collection forms and form instructions can be found here as well. I highly recommend reviewing the table of instructions for each pathway and using that document as you are reporting. This will help guide you with the reporting process and help you to understand how to report in each pathway. So here is the Therapeutics Form and the Therapeutics table of instructions. And this can be found on the webpage. Again, the most recent version of the data collection forms and instructions for each of the pathways can be found on the module webpage. And you can find these documents under data collection and form instruction, under the data collection and form instruction section. Again, please reference these documents, especially the table of instructions when you're reporting data into any of the pathways. This is going to be super helpful. So next, I will review how to access the COVID-19 pathways in the NHSN application and data reporting options. Okay, so to access the NHSN COVID-19 module, you'll want to log in to your facility using SAMS, and this will take you to your NHSN homepage. And so this is what you will see when you log in, and on the left-hand side, you'll see the menu, and you can click on COVID-19, and what will pop out is this little menu here, and this shows you, this is what I was talking about earlier, this shows you what daily reporting will soon be updated to. So soon you will see pathway data reporting, and that is where you will click on to enter data for any of the 5 surveillance pathways. So as shown in this slide, a calendar defaulting to the current month will appear when you select daily entry, which in the future will be pathway data reporting. When you select that from the left-hand side menu, data may be entered up to the present date. Users can also use the arrow icon to navigate to previous dates. This function will be important if you are wanting to enter retrospective data or correct any previously entered data. So for the therapeutics pathway, retrospective data is to be entered back to February 1st, 2021. All right, here are our options for surveillance pathway data reporting. From the calendar view screen, users will have the option to report data for the therapeutics pathway either through importing a complete CSV file or by manual data entry. These reporting options are available for all 5 of the pathways. The first option is CSV files. This pathway reporting option enables individual facilities as well as groups and supergroups, so something such as a health department, excuse me. They can upload data from one or more of the pathways into the NHSN application using the available CSV templates and upload CSV function that are located at the bottom of the calendar view page. And we'll look at that in the next few slides. A key difference between importing CSV files and manual data entry is that a facility can choose to have a group or supergroup report data on its behalf through bulk upload. So our second and most common option for reporting COVID-19 data is manual data entry. Regardless if pathway data are imported into NHSN using CSV file, upload, or entered manually, the calendar has a really nice feature built in that enables facility users to validate if a pathway is complete or incomplete. This validation, so what you see on the screen here, the entries showing up in green or yellow, this is immediately available on the calendar date for pathways in which data were successfully imported or manually entered and saved. So in this example, you can see the therapeutics pathway is green, and this indicates that all data elements were answered and saved. Or if it was a CSV file, then it was saved, it was uploaded and saved successfully. The calendar review allows NHSN users the option to quickly verify complete data were either imported via CSV file or manually entered and saved. NHSN does not use the calendar view page to determine data completeness. So as you can see here, therapeutics is green, and a pathway highlighted as green indicates complete data was entered and saved. In other words, a response was reported for all data elements in that pathway. And then you can see here that the resident impact and facility capacity pathway is highlighted in like a tan or yellow color. And this indicates one or more of the data elements in the pathway did not have a response entered by the user. So as previously mentioned, the calendar view page is where a user will begin the process for reporting data to NHSN. And this is either manually or by CSV file upload. If data will be reported via CSV file upload, then scroll down to the bottom of the calendar to access the tabs for importing and exporting pathway data. And that's what you see here in this screenshot. So to access the most recent CSV template for the therapeutics pathway, as well as the other COVID-19 pathways, click on the Download CSV Template button, and that's marked as number 1 on the screen. Keep in mind, though, that the templates and the file layout for the CSV uploads are available on the Long-Term Care Facility COVID-19 webpage. You can find those documents under the Resources tab. Next, the process for uploading one or more completed CSV pathway files to NHSN begins by clicking on the tab labeled Upload CSV. And you can see this on the screen. It's marked as number 2. And then marked as optional on the screen, there's also an option to export CSV data into table format. And you can do that for CSV file upload, or if data was entered manually, you can use this Export CSV button if you would like. So some considerations for importing data to NHSN. As previously mentioned, a facility can choose to have a group or supergroup, such as a health department, report data on its behalf if the group has the capability to collect and export facility level data for this member. There are 2 important considerations to keep in mind. So manually entered and saved data supersedes imported data. In other words, manually entered data will automatically override uploaded via CSV file, any data that was uploaded via CSV file, if the submission dates are same. Also, if a facility has entered its own data, it will not be overwritten by a bulk upload or by a group or supergroup. So the next thing to note, it is recommended that long-term care facilities only grant access to one group or supergroup to upload data on their behalf. Uploaded data by one group or supergroup via the CSV bulk upload can be overwritten by a second group uploading data for the same long-term care facility at a later date. All right. So if you're wanting some more information about CSV file uploads, and you can go to our webpage, and under resources is where you can find information as far as CSV data file templates for facilities and groups. So we've got the CSV templates for each pathway listed here, and then you can also see the file layout documents that go along with those templates as well. So here we have the therapeutics template for CSV upload, and the template is here on the left-hand side where my mouse is. And you can see that there's some data already entered into this template. That's just example data. So make sure you delete that before you submit and upload any of your CSV files. Otherwise, this will be included in your data. And then over here on the right-hand side of the page, we've got the therapeutics file layout for CSV upload. So this will help guide you in using the CSV template, and this will kind of tell you what's required and conditionally required, things like that. For the remainder of the presentation, the focus will be on manual data entry into the therapeutics pathway. So we'll keep going with that. As previously shown on one of the slides, once you log in to NHSN and you click COVID-19 on that left-hand side menu, and then you click daily reporting, which again will be pathway data reporting in the future, the calendar view page will open. And this is where the user will begin the process for reporting pathway data to NHSN. To enter data manually, you will click on the date for which Therapeutics Pathway data will be entered. So for training purposes today, we are going to use March 4th for the date of reporting data. Just as a reminder, users are to retrospectively report therapeutics data back to February 1st, 2021. Also remember, these are not cumulative counts. Please enter the therapeutics that were administered during each reporting week. It should not be a running total or cumulative count when entering data each week for this pathway. And just also to note that you just need to report into this pathway once a week. Like other data reporting pathways, NHSN users have flexibility when it comes to entering data in a therapeutics pathway. So for example, after logging in to the NHSN COVID-19 module, you may enter data for one pathway only or for multiple pathways. Also, users may edit data entered in the therapeutics pathway to correct previously entered data. After clicking on the date for which data will be entered, a new window will open displaying the 5 tabs representing each of the COVID-19 module surveillance pathways. So you can see that in this screenshot here where my mouse is. And this is what will open up when you click on your calendar. So the date for which counts are reported will auto-populate based on the date selected on the calendar view page, which is highlighted here, March 4th. The default view is the resident impact and facility capacity pathway. So as soon as you click on a date, the first pathway that will show up and appear is the facility resident impact and facility capacity pathway. You don't have to enter data in that first. You can go to whichever pathway you choose. There's not a specific order that you have to report in. And then also each pathway has the option to save or cancel. So just make sure you're clicking save before you're done. So this is going to be important to note here. Before any data can be saved in the therapeutics pathway or any of the pathways, the user must click on the resident impact and facility capacity pathway and enter the current census. So that's what you see here on this slide. Once counts are entered for the current census, you may navigate to the therapeutics pathway or whichever pathway you're reporting in, and you can report your data and then click save. But you have to put in this current census in order for any of the data and any of the pathways to save. So as shown in the screenshot here, the therapeutics pathway, this is the therapeutics pathway with the data elements that were last updated on March 4th. There are 2 questions, each requiring only the new counts of residents who received treatment from a listed therapeutic during the reporting week. So over the next few slides, we'll discuss that in more detail. I do want to bring to your attention the save and cancel options down at the bottom. A user should always click save after data entry completion. By clicking save, all entered data, including the current census that you entered previously into the resident impact and facility capacity pathway, that'll all be saved. If you click cancel, all responses will be erased. And then also, I just want to make a note here as well. If a resident receives bamlanivimab alone and no other therapeutics were received, select only bamlanivimab in the application. Do not also select bamlanivimab plus etesivimab in the application. And you can see that here, and we'll look at it in a couple other slides as well. But this up here at the top, when you're in the pathway, the first option that is listed is bamlanivimab, and that's where you will enter counts if a resident received bamlanivimab alone with no other therapeutics. Therapeutics are defined as a treatment, therapy, or drug. The therapeutics that are present in this pathway are monoclonal antibody therapies that may be administered as a treatment for individuals with COVID-19. Please note, the therapeutics in this pathway are not vaccines, nor are they related to vaccinations or vaccine status. So the 3 therapeutics that we have listed in the pathway currently are bamlanivimab, casirivimab plus imdivimab, which is Regeneron, and then the last one here, bamlanivimab plus etesevimab. So I want to bring this to your attention one more time. When a resident receives bamlanivimab alone as a therapeutic, no other monoclonal therapeutics are given. Do not also select bamlanivimab plus etesevimab in the application. So you can see here that bamlanivimab is highlighted in yellow. And if a resident receives only bamlanivimab, not in conjunction with any other therapeutics, then you will mark your counts here in either one of these boxes, just for bamlanivimab though. Okay. As previously shown, the therapeutics pathway consists of 2 questions for each listed therapeutic. Since the last date these counts were collected for reporting to NHSN, indicate the number of residents who received one or more of the listed therapeutics based on in-house stock or stock that was stored at another facility. So in-house stock is going to be stock coming from your facility, like the pharmacy in your facility. And this can also include if, say, an infusion nurse comes to your facility and they administer a therapeutic to one of your residents and they're using the stock that was from your pharmacy at your facility. And then stock stored at another facility is, the therapeutic is coming from an outside pharmacy somewhere. So this can include also if an infusion nurse comes to your facility and they administer a therapeutic to one of your residents, but they brought that therapeutic with them from an outside source. Okay, so we've got a couple case studies here. This is the first one. And for case study 1, we're going to use DHQP Nursing Home. And for their nursing home, therapeutic pathway data are reported on Fridays of each reporting week. So for this week, this is the reporting week of March 12th. And during this reporting week, resident A received bamlanivimab on March 8th, and this was from stock stored at the facility. And then resident B is transferred to the hospital where the resident received bamlanivimab after admission, and that was on March 9th. For resident C, they received an infusion of bamlanivimab on March 10th from an infusion nurse who brought the therapeutic to the facility from an outside pharmacy. And then resident D received bamlanivimab plus etesevimab at a local emergency department on March 11th. No other residents received therapeutics during the reporting week. Okay, so on the next slide, we'll go through how to enter that data into the pathway. So this is where you're going to record the counts. And for this case study, 3 residents received bamlanivimab during the reporting week. 1 resident received this therapeutic with stock stored at the facility. So if you can see my mouse, this is where you will note that. And 2 residents received this therapeutic from stock stored at an outside facility. So if you can still see my mouse, you will mark a number 2 here under the question asking where the stock, if the stock was from an outside facility. No residents received Regeneron. So we have put a 0 in both questions for the Regeneron therapeutic. Please put a 0 here. If 0 residents received a therapeutic during the reporting week, please put a 0 when you're entering your data. Don't leave it blank. A blank data element can be considered missing data. So to avoid that, just put 0s if 0 residents received a specific therapeutic during the reporting week. And then also in this case study, 1 resident received bamlanivimab plus etesevimab from the stock stored at an outside facility. So we've put a 1 over here, if you can see my mouse, we put a 1 next to bamlanivimab plus etesevimab under the question asking about stock stored at an outside facility. So up here at the top where we've got bamlanivimab, these residents received this therapeutic alone. It was not in conjunction with any other therapeutic. So that's why those counts are put here at the top. Okay, so we are done putting in our numbers here. So we go to click save, and then we are given an error message. This is because we didn't enter the current census yet. So we need to click OK to get rid of the error message and go back to the resident impact and facility capacity pathway. So we're back to the resident impact and facility capacity pathway, and we go ahead and enter our current census. And that'll be the current census for the date in which you are reporting. So for us, we're reporting on March 12th. So we put in the current census for March 12th, and then we go to click save. And we can see down here that the calendar view page, our therapeutics pathway is appearing in green, which indicates that all of the data elements were answered. So that is good. We're good to go there. Okay, let's go on to the next case study. Therapeutics pathway is still reported every Friday. So now we're on to the next week. This is for the reporting week of March 19th. And the following residents received a therapeutic. So resident A received bamlanivimab on March 15th from stock stored at the facility. And resident B received casirivimab plus imdivimab, which is Regeneron, at an infusion center in which the stock came from the infusion center and was administered in the infusion center on March 16th. And then our last resident here, resident C, received an infusion of bamlanivimab plus etesivimab on March 17th from an infusion nurse who brought the therapeutic from an outside facility. No other residents received therapeutics during the reporting week. Okay, so we will keep going and see how we enter that data. So we bamlanivimab during this reporting week with stock stored at the facility. So as you can see here on the screen, for bamlanivimab, it was administered alone, not in conjunction with any other therapies, and it was from stock stored at the facility. So we put a number 1 next to that question for bamlanivimab, and then we will put a 0 for the next question for bamlanivimab because 0 residents received that therapy from stock stored outside the facility. And then we had 1 resident who received the Regeneron therapeutic from stock stored at an outside facility. So you can see here for Regeneron, we've got a 1 in the question for stock stored outside the facility. And then we have a 0 for Regeneron regarding stock stored at the facility because 0 residents received Regeneron from stock stored at the facility. So we have to mark that with a 0. And then also 1 resident received bamlanivimab plus etesivimab from stock stored at an outside facility. So this is going to be similar, obviously, to Regeneron, the way that we entered our data. So you will put a 1 here in the question asking about stock stored outside the facility for bamlanivimab plus etesivimab. And then you will put a 0 for the question regarding stock stored at the facility because 0 residents received bamlanivimab plus etesivimab from stock stored at the facility. So we've got all of our numbers in the pathway. So we go ahead and click save. And once we click save, we get the message that says that our data was successfully saved. So just a few takeaways and reminders about the therapeutics pathway. When reporting counts, only include new counts since the last time counts were collected for reporting to NHSN. Do not include the same resident in the same count every day. This means you are not to report any cumulative counts for the therapeutics pathway. Also note, this pathway is not for reporting vaccination status or vaccine counts. This pathway is only for reporting therapeutics that were administered during the reporting week. If 0 residents received therapeutics during the reporting week, please enter a 0 for all therapeutics listed in the application. A blank field could be interpreted as missing data. Please make sure to report a 0 to avoid any missing data. So if you have a reporting week where 0 residents received therapeutics, then you'll put a 0 in all the boxes in the therapeutics pathway. And then also, when entering data for one of the questions for a therapeutic listed in the pathway, you must then enter data for the other question in the therapeutic. This can include a 0 if applicable. So that's what we were doing in in the last case study I was showing, where if you put a 1 in, let's say for bamlanivimab from stock stored in the facility, so you put a 1 there, the next question asking about stock stored outside the facility is going to become required. So if it's 0, then you can go ahead and put a 0 there. But once you answer one of the questions, the next question for that listed therapeutic will then become required. Okay, so this concludes the long-term care facility COVID-19 module Therapeutics Pathway training webinar. Thank you all for joining. If you have any questions, you can submit them to nhsn@cdc.gov,